the scholars of Ayurveda and today's guest speaker, Dr. Muralidhar Bhatt sir, who have joined us for the 181st episode of Gyan Ganga, a knowledge voyage weekly webinar series. I, Dr. Pooja N, on behalf of RAV, welcome you all for today's session. On the onset, I would also like to express our heartfelt gratitude and welcome all the mentors who have always been there to guide, motivate, and encourage us for this series. Respected Padma Bhushan by the Sri Devendra Tribhunaji, President Governing Body RAB. Respected by the Sri Rajesh Kotecha sir, Secretary Ministry of Ayush. Respected Dr. Vandana Siroha ma'am, Director RAB. Let us begin by seeking the blessings of Lord Dhanvantari. Namami Dhanvantari Madi Devam Sura Surai Vandita Pada Padmam Loke Jararu Bhayangatyunasham Dataramisham Vividhaushadhina. Now, I would like to introduce today's expert, Dr. Pangala Muralidhar Bhatt sir, who is going to share his views on the diagnosis and management of Madhumeh. Sir has graduated in Ayurveda from Gulbarga University in 1991 and further completed his post-graduation in Kaya Chikitsa from Mysore University in 1995. He has worked as a consultant in Maharshi Ayurvedic Organization initially and later as a lecturer at SDM College of Ayurveda and Hospital Hassan. Further, in the year 2000-2001, he worked as a visiting faculty at Nami Ayu Medical Center, Moscow, where he taught Ayurveda for medical college students. He has also visited the Thames Valley University, London, UK, as a visiting professor in the year 2002-2003 to deliver lecture for students. From 2003 to 2018, he was professor and head of department postgraduate studies at Sri Kalabhaireshwara Ayurveda Medical College and Hospital and Research Center, Bangalore, where he has guided many postgraduate students. Further, he started his private practice actively in 2000, that is Sudhanva Healthcare Center at Rajarajeshwari Nagar, Bangalore, and he is also a guru at Rashtriya Ayurveda Vidyapeeth under the Ministry of Ayush for the CRAB course from 2019. With these few words, I would humbly invite sir to begin the session.
Okay, thank you. Respected Padma Bhushan Vaidya Devendra Tribhunaji, Director RAB Vandana Sirohalji, and all the Gurujans and our CRB students. I'd like to today talk about the diagnosis and management of Madhumeh. Slides are visible, ma'am?
No, sir, you actually stopped sharing. You need to again click share and minimize this app. Share entire screen, you click, then minimize this Zoom app, your slides will be visible.
Okay.
Share screen window or tab, the entire screen. Then now you can minimize the current app screen, then the slides will be
Coming now.
Yes, sir. It's the same.
Okay, thank you. So I'll briefly some of the points I would like to highlight regarding because Madhumeha is one of the Prameha. Few points I would like to highlight here. One is the Pra and Meha. Prakarshena, excessive. It is also called as poly or excessive. Meha is urination. It is polyuria. Prabhuta Mutrata or Avila Mutrata, these are all the prime symptoms should be observed. Here, Avilata is a turbidity in the urine. There are 20 pramehas mentioned and innumerable pramehas also there. But for the doshic point of view, for Kapha it is 10, Pitta it is 6, and Vata it is 5. 4 types of prameha has been mentioned. So prabhuta mutrata and avila mutrata, these are two things to be observed in prameha. So nidana, you know all, this asya sukam swapna sukam dadini gramyautaka anupa rasapayamsihi navannapanam gudavaitritam cha pramehe hetu kafakritra sarvam. I'd like to point some of the nidana in later slides also, just to highlight things which I want to convey. The classification of prameha is, one is physical, apatarpanajanya prameha and santarpanajanya prameha. From the nidana point of view, sahaja prameha and apatti nimittaja, and parinamajanya is the metabolic, another one way of classification. Prameha, they say tridoshakopanimittaha vimshati pramehaha bhavanti. All tridoshas are involved in all types of prameha. Vikarascha aparisankhya, there will be innumerable complications. Some people say it's innumerable, other variations of the disease itself. Some says it's a complications of prameha itself, innumerable of complication. Sushruta points out, Shukradosha pramehastu vyanapana prakopajaha. Vyana and apana involvement is there in the disease prameha. So as I pointed to general prameha nidana, there are so many things are there, gramyahara, audaka, anupamamsa, or nava, dadi, sarpi, all things, except yat kinchit vidir anyo api shleshma medo mutra sanjanana. Whichever which causes shleshma medo mutra sanjanana is considered for the prameha in general. Bahudrava Sleshma Dosha Vishesha. In the Samprapti, what they are pointing out, Bahudrava Sleshma Dosha Vishesha. Bahudrava Sleshma Dosha Vishesha iti Bahudrava eva kafo meha janako na alpadrava iti. In normal course, the Guru, Manda, Hima, Snigda, Slakshno, Masnaha, Stira Kafaha. But here, Kafa is not Stira, Kafa is Drava. Hence, this Samprapti, in Samprapti Kataka, Drava play a major role. And Bahu Abadda Mamsa Medaha. Bahu Abadda Medho Mamsaha. Sharireja Kledaha, Shukra Shonita, Vasa Majja, Lasikaha, Rasaha, Ojaha. These are all the Dushya Visheshaha. Here, Abaddamiti Asammatam. Atratu Bahutvam Aghanatvam. That means not Ghana in nature. यथा योग्यता बोद्धव्यम तेन मेदसी मांसे वसा मज्जा द्वयमपि, that means they are asammata and abadda also, drava and bahu agana. Shesheshu only bahutvam, that means lasika, other things are only bahutva, they are not drava. This is we have to differentiate. So I would like to point out here Bahu Abadda Mamsa Medaha. Whenever we think, look at the modern point of view, always we think that Abadda Mamsaha or Abadda Meda means adipose tissue or muscle tissues. But what we are seeing, it's further deep in each and every cellular component. For example, you consider the cell structure itself, we can see glycolipid, phospholipids, glycoprotein, these kinds of link is there in each cellular membranes. And also if you see go further, nuclear membrane, endoplasmic reticulum, mitochondria, all these area also the Mamsa Medha is present in its rudimentary form, or I can say it is a structure. With that, that cellular component is sthira in nature. That's abhaddata is not there. It will be not allowing everything inside its wall or the membrane. So the bhaddata is there. That is the sthirarupi kapha we can see in each and every cellular structure and its component. So we have to differentiate between mamsa peshi and mamsa. Mamsa Peshi is one of the outcome of Mamsa, but Mamsa is there pervaded everywhere. Acharya Shushruta, while explaining about the Saptakala, Tasam Pratama Mamsadara Nama, Tasya Mamsa, Mamse, Sirasnayu, Damani, Shrotasam, Pratanam Bhavati. That means Mamsadara Kala, Mamsa is act like a bed for Sira, Snayu, Damani, Shrotasam, Pratanam Bhavati. It is pervaded. We can see a structure, all the vessels, microcapillaries, capillary bed, venous drainage, lymphatic drainage, all are neurological nerve endings. Everything is coming like a mamsa is like a bed for those structures. Hence, we have to consider abhadda mamsa meda is not only its adipose tissue or a muscular tissue, it is deep inside in the all over the body is happening in prameha. When we see the premonitory symptoms or pururupa of prameha, Svedanga Gandaha, Shitilangata, usually patient when comes to us as a pramehi, major complaint is Shitilangata. They feel intensive loosening of their joints or structure as if body structure has been loosened and feel like sleepy. And some of the symptoms like Shita Priyatvam, Galatalu Shosha, Madhurya Masyam, Karapada Daha. Karapada Daha is a prominent symptoms we can see in this prameha. So in the modern point of view, Karapada Daha is a complication of the Madhumeha. But for us, it is a Karapada Daha is a premonitory symptoms. Shita Priyatva, Galatalu Shosha, these are also complications there. Here we see it is a premonitory symptoms. Karapada Daha also may be a Vidaha Lakshana also. When Ahara is undergoing Paka, we can see Karapada Daha. Coming here to the specific Vataja Prameha, Madhumeha is one of the Vataja Prameha. I would like to highlight the Nidana of our Vataja Prameha. Here consumption is Kashaya Katutikta kind of Ahara and Viharas like Ati Vyayama, Ati Shodhana like Vamana Virechana, Stapana Bastyadi and Abhigata, Udvega. Udvega is one of the causative factor. Shoka. Nowadays we see all these Udvega, Shoka. This is some of the major cause for the Madhumeha to happen. Shonitatisekha, Jagarana, Vishama Shariranyasa. Sometimes he has diagnosed as a Madhumeha. They are doing too much of exercise to control their blood sugar. So this is also the Sharira, Vishama Shariranyasa or Ati Vyayama also a constitutive factor for the Madhumeha. So in this Vata Prakopam Apaddhate, Ojaha, Puna Madhura Sabhavam, Tad Ado, Prauksha, Dvayu, Kashayatwena, Abhisamsrijya, Mutrashya, Abhivahanti, Tata Madhumeham Karoti. So it drags the ojas from different parts of the body to the basti, and we are going to have the Ojomeha or Madhumeha in case of Vataja Madhumeha. So other types of Madhumehas are there. We will see its Nidana is slightly different. We will see. Madhumeha classified as Swatantra, in Swatantra and Paratantra. In the Swatantra, Sahaja, Apatya Nimittaja. Sahaja is Jata Pramehi, Madhumehinova, that is the one classification, or Bija Doshajanya. Apatya Nimittaja, Doshavrta Patajanya, Datukshayajanya. So Vataja directly comes under Datukshayajanya Madhumeha, Doshavrta Patajanya, where the Santarpana is the causative factor. In the Paratantra Madhumeha, we see a lot of Madhumeha nowadays. They come, one is post-Jvara, especially some of the Aganta Jvara. Later, after the Jvara, onset is gone, probably Jvara has not completely relieved. They may indulge in some of the Ahara Vihara, then they may land up in the Madhumeha. Amajanita and some of the Ama Vikaras also. Amajanita, for example, Charaka says, when we consume Kapha Utlishtakara Ahara Vihara, Kaphaja Bhava is going to be increased in the body. In the Nanatmaja Vikara, Kaphaja Nanatmaja Vikara, you can see Guru, Madhura, Snigdha, those qualities, Guru, Snigdha and Madhura Rasa is going to be increased. That is also a reason for the Madhumeha to happen. And another thing is, we are seeing some of the autoimmune diseases, like for example, vasculitis, or uveitis, rheumatoid arthritis, such kind of conditions where people are going to have the Madhumeha Lakshana also along with that disease. This is what we are seeing clinically. And Gulma Janita. In Charaka, after the Gulma Adhyaya, he mentions the Prameha. Reasons he says, in the Gulma, we are going to do most of the Snehana Chikissa. That Snehana Chikissa may lead to Gulma Vyadhi. That means a Kafaja Prameha. But apart from that, for example, if you see the Gulma, for example, Pittaja Gulma may lead to the Pittaja kind of Prameha or Avaranajanya Madhumeha, and Vatajanya Gulma, Vataja Gulma may land up in Vataja kind of Prameha, that is Madhumeha also. Here what we have to consider is the Gulma Nidana, Jvara, Vamana, Virechana, Atisaraddehi, Karshanena Karshitaha, Vatala Nannan Pibati, or Jara Vamana Virechana Atisaraddehi, Karshanena Karshito, Kafakara Ahara, or Pittakara Ahara, if he consumes, he lands up in Gulma. So in turn, they may land up in Prameha also. This is what we see. We see when they come to us with a history of Madhumeha. We can also see the prior to that, they may have to have a Gulma. Gulma Lakshana still persisting, or Gulma Lakshana might have been mimicked now. Only Madhumeha Lakshanas are visible. Another one is Grahani Janita. Many Grahani Vikaras are having the symptoms of Madhumeha. Still they have a Grahani Lakshana persists, and Madhumeha Lakshanas also persisting. Here, when these conditions, what we have to see is probably we have to treat that disease first, and automatically this Madhumeha will disappear. Ashyojanita. Charaka in his Arshanidana, Kafaja Prameha, he points out the Prameha is going to happen because of Kafaja Arsha Bhavas. People say, when we inquire about whether he had a history of Arshas, they say, I had it, I got it operated, or I underwent a procedure, it's disappeared, I don't have anything issue now, and right now I have only the Madhumeha. But Arshas lesions might have been gone. That particular area, Arsho, the lesions are not there, but Mamsankura may not be there, but still we can see Arshokara bhavas are still persisting in him. He requires more of Arshokara Chikissa rather than Madhumeha Chikissa. Then Medo Dosha Janita. This we can see Medas itself is a major causative factor. Medo Dhatu Agni Mandya leads to the Madhumeha. Then Galaganda the Vikara. So here, especially I wanted to point out many of the hormonal disease also, especially the thyroid hormone. So thyroid one, usually people have a diagnosis as a thyroid. Slowly, they keep taking medications, especially in the weather like in Bangalore. So we have lot of people, because of the pollutions, they have a borderline and the increased level of thyroid. They keep taking medicines. Down the line, in a few years' time, they may land up in Madhumeha. Many other diseases also. One is the Madhumeha. Here, treatment to be focused more on that thyroid gland rather than the other disease like Madhumeha. So, as I pointed out, it's a Madhumeha has two types. One is Kshineshu Doshashu, Anilatmaka, and Santarpanadva Kafa Sambhavasyat. Charaka, in his Sutrasthana, he points out the Santarpana Nidana for Madhumeha. Here he points out Guru Snigdha, Amra Lavana, Atimatram Samasnata, Navanna Panamcha, Navanna Annancha, Panancha, Nidram Asya Sukhanicha, Tyakta Vyayama Chintanam, Shamshodanam Akurvatam, Shleshma Pittam Cha Medascha, Mamsam Cha Ativardate, Teiravruta Gatirvayu, Ojam Adaya Gachati, Yada Bastim Tada Krichram, Madhumeham Pravartate. So in this Madhumeha, so if not, so this is comes and go. Sa Marutasya cha Pittasya Kafasya cha Muhur Muhur. Darshayati Akritim Gatva. Darshayat Akritim Gatva. Shayat Apyayate Puna. It comes and goes. Sometimes second time it comes with the vigorous symptoms. So if it is left like that, going to cause pidakas. Jayante pidakas saptadarunaha. Here, where it pidakas happens? Mamsaleshu avakasheshu marmaswapicha sandishu. So it may happen in deeper. One is visible, the pidakas, prameha pidakas outside. Some are inside, where marma or sandishu. So what kind of pidakas, including the like Sharavika, Kachapika and Vidrudi kind of pidakas? It may happen in the vital organs also. I'd like to highlight here marma and sandishu. So, for example, if you go to the minutest areas, as I mentioned, Mamsadhara Kala, the Kala is, Mamsa is a bed for Siradhamani Srotas. Here we can see the minute areas, for example, precapillary sphincters, the venules and the arterioles, size keep reducing. We can see precapillary sphincters. So, Shushruta, while pointing out the sandhis, he points out Kora, Ulukala, Samudga, Pratara, Sunnasevani, Vaishutunda, Mandala, Shankavarta. We can see Mandala sandhis are present, Nadi Shrotasu Mandalaha. These sphincters are coming under the heading in the Mandala sandhis. This is there pervaded in all Shrotasas. So in this Sandhisthana of Mandala Sandhi, there is a chances of formations of the any kind of pidakas may lead to obstructions, and we'll have a lot of complication arising out of those things. For example, if the Marmasthana happens in the Shiras, Hridaya, he may have a Hridroga, he may have a Shiroroga, he may also have a Vrikkaroga, or in the disease of the eyes, different complications will be arised out of vital organs. So in the modern point of view, usually we compare Madhumeha with the diabetes mellitus. Let us see a few slides about this one. Diabetes is a metabolic disease characterized by elevated levels of blood glucose. It leads to various complications either to the heart or vessel walls as well as kidney and nervous system. So most common is type 2 diabetes. It occurs when the body becomes resistant to insulin or doesn't produce enough insulin. Here also they points out is the polyuria, polydipsia, polyphagia is the major cause for the diabetes, primordial symptoms of the diabetes mellitus. Sometimes they say it is absent, only blood sugar is elevated, these symptoms will be absent. Some of the other symptoms include blurred vision, delayed wound healing, fatigue, etc. So I'd like to point out here, whoever comes to us, patients, diabetes mellitus diagnosed, or they are taking the medicines for the diabetes mellitus, none will have polyuria, polydipsia, polyphagia. Or our prameya lakshana, prabhuta mutrata, avila mutrata is not seen at all. Many of the times we diagnose based on the blood sugar level. There is an intensive difference there between madhuryata of tanu, madhuryata of rasarakta. That's what we have to differentiate. Madhuryata of rasarakta is seen, but madhuryata of tanu is not there. The whole body gets madhurata, then we have to call it as a madhumeha, not otherwise. In modern point of also, the diabetes mellitus indicates its core symptoms should be there. Otherwise, how can we call that as a madhumeha or diabetes mellitus? For example, Jwaram Pratyatmakam Lingam Santapo Deha Manasa. The Santapa Deha Manasa should be there. Atisara Gudena Bahudrava Saranam Atisaram. Or the disease like Raja Yakshma Palamamsa Kshaya. Like that, here Prameha, Prabhuta Mutrata and Avila Mutrata should be there. Then we can consider. Or as per the modern point of view, polyuria, polydipsia, polyphagia should be there. Simply by looking at the blood sugar elevation, we can't consider that as a madhumeha. In my clinical practice, I make sure that if they don't have all these symptoms, even though sugar are high, I won't consider this as a madhumeha patient. So this is usually present day diagnosis of the diabetes mellitus. They ensure that blood sugar normal FBS should be below 100. Pre-diabetes 100 to 125, diabetes above 126. Postprandial also readings like this, HbA1c, another reading they say. And oral glucose tolerance test, they also point out how much it should be there after 1 or 2 hours. So in my clinical practice, I ensure following test before conclude that it is a diabetes mellitus. Usually they do checking the C-peptide levels, or lipid profiles, other things. I ensure I'll check the fasting insulin level. Most of the patients, if their insulin levels are good, we need not consider as a, even the high sugar levels are there, we need not consider that as a Madhumeha. Fasting insulin level above 8 is good enough. The patient who takes or who is taking insulin, their fasting insulin level is more than 70, 80 like that, then they have a intensive resistance to insulin. Insulin, whatever they are taking, it is not at all acting. We also have to check the C-peptide level to confirm whether the pancreas is really not functioning or not. The beta cells, whether it's functioning or not. Another test is HOMA insulin resistance. This we can check in the Google it, and you can see in the net. So we have to see fasting insulin level and fasting blood sugar level. That is a parameter to put inside. Then it will give whether he has a insulin resistance or not. Homeostatic, the level of the insulin resistance, HOMA insulin resistance. So if it is below 2.6, it is, they don't have a resistance. About 2.2 to 2.6, they have a resistance to insulin. Confirm that we have to relieve the sensitivity, or the resistance has to be relieved. And also we have to see the lipid profile. And another important finding is serum homocysteine level. I check usually in the patients. This is a test to ensure how the microcirculations are happening inside the body. For us, it is a rasadushti lakshanas. When rasa pradoshti vikara is there, homocysteine levels are very high. To confirm whether rasadushti is there or not, so or raktadushti is there or not, we can confirm it. And microcirculations are not happening if these levels are high. We may get a different kinds of symptoms of bahudosha if these levels are high. Various factors, according to modern science, contributing to diabetes mellitus is one is thyroid dysfunctions and hormonal imbalance like leptin, insulin, estrogens, androgens, growth hormones. These are all some of the hormones. So estrogen is usually in the after the menopause. Women usually they don't have it. So at that time they are prone for that type 2 diabetes mellitus. So testosterone level also predisposes, growth hormones, leptin hormones. This leptin hormone, more research studies are required. Still, it's not underway. Leptin play a major role in the adipose tissues and fat depositions inside the body. So complication, you all know the microvascular complication and macrovascular complications. Brain, heart, extremities are going to be affected. Some of the common medication used, we have to aware of it, because people come with us. Initially, they start diabetes mellitus 1 tablet, then down the line, if it is not controlled, 2 tablets, 3 tablets. Nowadays, we can see the bunch of medicines are used by the patient. One day he'll also start taking the insulin. So sometimes they are fed up with the medication. Later, they will come to us with no choice. Some people are coming in the beginning itself. Some will have a good control over their diet, lifestyle. They manage with the minimal medications, but sometimes they also prone to take different kinds of medications. So hence, we have to have a little knowledge about when they ask, either they'll come to us, can you withdraw some of the medicine? We should have some little knowledge. So I just point out few things. So how it is acting also. One is sulfonylureas commonly used, and meglitinides and metformin. These are all the commonly used medications. Majorly, it increases the insulin secretions, and also does glucose uptakes by the muscles, which will be increased. Some of the things which decreases the absorption of glucose from the gut itself. Some are feeling a satiety feeling, decreasing gastric emptying and increased satiety feeling, so that people they don't want to take the medications. That kind of feeling will be there. And some medications, SGLT2, inhibitors cause inhibition of 90% of glucose reabsorption and resulting in high glycosuria. So this is one of the important things. I usually point out to the patient that this is a normal phenomenon is happening in you. When you are overweight, when, when there is a body is going to lose the weight, your blood sugar go high, your lipid levels go high, they go in the form of urination, you started losing weight naturally. Allow the body to lose weight till your ideal weight. Then still blood sugar is high, then we start the medications. Otherwise, no need of giving medication in the beginning itself. So if you are overweight, allow the body to lose weight till you come to ideal weight. Then still, if you have any symptoms, then we have to tackle the symptom. That's why I point out that this is nowadays is coming in the form of medicines. The renal glycosuria is a condition, kaphaja prameha. So there is a medicine has come up nowadays to make that to happen. The glucose reabsorption prevented, so glycosuria is going to happen. Another one is at the central level, it's happening hypothalamic, the circadian rhythm, resulting in reversal of insulin resistance and decrease in the glucose production itself. So this is acting at a higher level. So we can make the persons calm and cool. This result can be achieved without medication. So in our clinical practice, it has been observed that elevated blood sugar levels, elevated blood pressure, and elevated lipid levels are present in the following avasthas. One is Sama, Kapha, Pitta. Another one is Bahudosha Lakshanas, when the doshas are increased in the body. Rasa and Rakta Pradosha Vikaras and Nidanartakara Roga. So many studies have been done. For example, one of our colleague has done the Ubayatara Shodhana in the Madhumeha. I asked her how you have selected the case. Then they said it is very difficult to have a proper Madhumeha patients. We selected based on the blood sugar level and HbA1c level, and we collected those patients. For example, parents are diabetic, we went and checked their blood sugar, children's blood sugar, we checked it, HbA1c high, we took those kinds of cases to monitor. So this is observed that for them, more of Sama, Kapha or Pitta Lakshanas are observed rather than the Madhumeha Lakshana. Only elevated blood sugars are seen, elevated HbA1c is seen, but no premonitory or the core symptoms of Madhumeha is observed. Bahudosha Lakshana, here also Aruchi, Arochaka, Agnimandya, Atinidrita, Nidranasha, all these symptoms are seen in those patients. And Nidanarthaka Roga, as I pointed out earlier, the Gulma, Grahani or Arsha, these are all the causative factor for the Madhumeha. Coming to the Chikitsa Sutra, in general, I would like to say, later we will go to the in specific. Thula Pramehi Balavani Ekaha, Krishastasya Paridurbalasya, Sarbrahmanam Tasya Krishasya Karyam, Shamshodanam Dosha Baladikasya. Shodana for the Dosha Baladika conditions, Sarbrahmanam Tasya Krishasya Karyam. So Snigdasya Yoga Vivida Prayojya Kalpopadishta Malashodhanaya. For the purpose of Shodhana, you select different kinds of yoga for the Vamana Virechana. Once it is done, Ata Urdvaha Tata Adascha Male Apanite Meheshu Santarpanameva Karyam. So this we have to ensure. Once the Shodhana is done, later object is Santarpanameva Karyam. If not, Gulmaha Kshayaha Mehana Bastishulam Mutragahascha Apatarpanena. Pramehinasyu Paritarpanani Karyani Tasya Prashamiksha Banhim. What we have to do once Shodhana is done, or when you have done the, if not Shodhana, you have done Karshana therapy, you have done Asanadi Kashaya or something Kashaya. So when you have achieved the Apatarpana, then we have to go ahead with the nourishing kind of therapy which control the Madhumeha rather than otherwise patient will have a Gulma, these kinds of disease. We see many patients, those who are taking anti-diabetic medications, Ayurvedic or allopathic, they have these kinds of symptoms. Mehana Shula, Basti Shula, Mutragraha, these are all the symptoms we observe. Hence, Santarpana Chikitsa to be carried out in later aspect. Shamshodhanam narhasi ya pramehi tasya kriya shamshamani prayojya. Manta, Kashaya, Yavachurna Leha, Prameha Shantascha, Lagavascha Bhascha. In my clinical practice, I give the Manta Prayoga. I'll ask if it is very severe, Lakshanas are seen, I give them Manta maybe twice a day. Yeah? So Manta usually made out of the Yavadhanya or Sashashtikam Satrinadhanya Mannam. Trinadhanya has been mentioned. Trinadhanya Mantha also you can prepare and you can give it. So morning one Trinadhanya Mantha, night one Trinadhanya Mantha, afternoon maybe having a one food a day. Single meal, 2 times they are going to take Mantha Prayoga. Sashashtikam Trinadhanya Mannam Yava Pradanastu Bhava Prame Bhavet Pramehi. Yavasya Bhakshan Vividam Statas Adyat Kafa Pramehi Madhu Samprayuktam. So Trinadhanya, Sashtika or Yava, these are all the major things have been mentioned. One thing I'd like to point out here is Charaka has cleverly used some of the procedure to conquer the blood sugar. One is Kara, Ashwa, Go, Hamsa, Prishta, Bhutanam, Tata, Yavanam, Vividashta Bhaksha. These animal had to be fed with the Yava. Then its dung to be collected. Dung to be collected, either barley or wheat or bamboo seeds. Dung should be collected. That has to be given in various forms, suffering from the Madhumeha. Here I'd like to give one example. Coffee bean that have been digested and excreted by the Asian palm civets, Popilluwalk, is said to offer a range of benefits from reducing the inflammation and boosting the energy to improving the digestion and mental focus. This is also, once it is consumed, it has excreted, then it has come out. So probably Charaka has some ideas. Once it enters the intestinal tract of those animals, then comes out, it has a most of the effect to reducing the probably the blood sugar or prameha karaka, reducing the prameha karaka sampraptis. Then further, we can see Sarodakam Kushodakam Madhudakam Trifala Rasam. So these are all the things to be administered. Kadirasara, as a water drinking purpose, you have to give this kind of water. Kushodakaha. I have seen some of the patient of Pittaja kind of Madhume, Pitta Pradana, where the blood sugars are elevated. We have given Kushodaka. Very effective results are seen. The burning sensation, Karapada Daha, or the intensive Daha all over the body, and Mutra Krichra, Mutra Daha, all these symptoms have reduced drastically by giving the Kushodaka. Madhudakam va Trifalakasha. Madhudaka can be given in Kapha Pradana Lakshanas, but maybe a day or two. For example, this Madhudaka is very good for some of the internal pidakas also to reduce that pidaka, internal blood clot also to reduce the internal blood clot. And Trifala Rasamba. Sidum Pibedva Nigadam Pramehi. He also recommends some of the Sidu. This will probably prevent the blockages, can be easily prevented. So as I said earlier, the homocysteine levels are high. If you give these kinds of things, it reduces that level, and the easy circulations are seen in small minute capillaries. Siddhani Tailani Gritani Chaiva, Deyani Meheshu Anilatmakeshu. Medaha Kafascha Kashaya Yogi, Snehescha Vayu, Samameti Tesham. For example, in Vataja Meha, the Nidanas are Kashaya, Ruksha, these kinds of Meha, Ativyayama, Udvega, Chinta is the causative factor. If you give further advise them the Kafahara Yoga, looking at their blood sugar level, the sugar reducing medications, this may not be helpful. There we have to give Sneha prepared out of the Sneha, that in the form of Taila or Grita, prepared out of the Kashaya mentioned in the Kafaja Prameha or in the Pittaja Prameha, that Sneha to be given to the Vataja Prameha. Then Vyayama Yogi Vividha Pragadehi. So the medical point of view, always we have to consider. For example, our chikitsas has classified into 3. Devapasha Chikitsa, Yuktivapasha Chikitsa. Pardon? Able to hear? Hello?
Yes, okay.
Okay. Okay. Vyayama Yogi Vividha Pragade Udvartane Snana Jalavaseke सेव्या
होगा गुरु जी, दिख
त्वगेला
रहा है।
चंदनाद्यैः विलेपनश्चाशु न सन्ति मेहाः. So our chikitsa classification is Daivapasya chikitsa, Yuktivapasya chikitsa, and Sattvavajaya chikitsa. If you give equal importance for these, 33%, 33.3% goes to Daivapasya, 33.3 goes to the Yuktivapasya, another 33.3 to the Sattvavajaya. If you go further down in the Sattvavajaya, Yuktivapasya, what we are doing, we can further classify into the Ahara, Vihara, and Aushada. That means another almost 11 percentage will go to each. Then if we further go Ahara, Vihara, Aushada, Bhashya, and Abhyantara. Then if you go further classification, Shodhana, Shamana, the medicine is having a very less in any of the disease is concerned. So what we have to tackle these kinds of disease is different kinds of other approaches like the Sattvaja Chikitsa, Devapashya, and Vityopashya. So apart from Aushadhi, my recommendation Ahara and Vihara. In Ahara, as Charaka mentioned, go for a very light diet. Don't take diet beyond heavy diet should not be consumed in the later part of the night. Very light diet to be consumed. And when sickness is there, go for a Manda, Peya, Vilepi kind of diet. Maybe for about few weeks, you will come to a Langita Lakshana, proper Langita Lakshana. Then you can resume the normal diet. Ensure that you are not crossing the Sastha Lakshanas. So here, Vyayama plays a major role in tackling the Madhumeha also. Udvartanaha, Stana, Jalavasekaha, Sevya, Twagela, Agaru Chandanadyehi. Vilepanesh chashu na santi meha. Here two things are there. Sevya, some people say it is Ushira, some people say consuming or applying Togela, Hagaru, Chandanadyehi. So simple external application also going to have a much impact on the Prameha. So the current observations are patients are presently diagnosed with diabetes mellitus without core symptoms. Polyuria, polydipsia, and polyphagia are not present in the diabetes mellitus. So only 5 to 6% of patients presented with the core symptom and also have increased level of blood sugar. Most patients with increased blood sugar levels are generally overweight. Few patients had increased level of blood sugar but low levels of fasting insulin. On the other hand, some patients had increased level of blood sugars along with the high levels of fasting insulin, indicating insulin resistance. Some people presented with only GI symptoms, but later on developed the increased level of blood sugar. Stress, anxiety, and phobia are seen in many people having increased level of blood sugar and vice versa. Some of the case studies I'd like to highlight, then we will close the session maybe another 15 minutes. Patient with complaints of imbalance while walking, occasionally Brahma, Daha in the Sira Pradesha, Krishata of Sharira, that lost some amount of weight, 8 to 10 kgs, and increased Shuddha. Patient also had a history of Shoka. When he came about a couple of years later. He was taking modern medicine. He came in June 2018. His PPBS was above 300. So initially I gave some Shamanoshidhi only and also counseled him, and it went down. And somewhere in the 2021-22, he got retired from the work. His sons were not settled. He once again had got into the Shoka. So once again levels went up, then again came down. Now it is in the downside only. So when they went high in the beginning also, when level went high, we did the course of Takradara with the Amalaki Kashaya. So immediately we can see drastic change in the reduction of the blood sugar and other symptoms also. We also gave some Shamanaushid like Chandra Prabhavati. Chandra Prabhavati usually my choice in most of the patients. It also prevents the complications coming out of the Madhumeha. And whenever Daha Pradhanata is there, I'll prefer Daha, Brahma, I'll prefer the Chandanasava. Nishamalaki as a Rasayana I give for a long duration. Chandraprabha also, sometimes we give a long duration considering both as a rasayana. And Sirabala 101 given. Usually we give medicine for a short durations. In case of need only, we will continue. This is the trend here. Another patient came to me with a history of Atimutrata, Sharira Krishrata, Daurbalyata, and Oshta Shushkata. He had a history of Santapa. This is the finding. So blood sugar level increased since 10 years. It is showing more than nearing 500. Post this fasting is more than 175. Here also we did a course of Takradara and also we did a course of Virechana. Then whenever he complained of intensive Daurbalyata, we used to give Vasanta Kusumakra Rasa for about few days. So another patient with a complaint of a Grihani Roga. His complaint was Shula in the Manya Pradesha, associated with Stabdata and Kramat Shula to the Vamabahu. And he checked many times his cardiac condition since it is referring to the Vama, but actually he had a more of cervical lesions. So also had a Aprakrita and Apachita Malapravati, which is a primordial symptoms in Grihani. And also observed Shirashula. So he was on medication, diapride, and with that also blood sugar is showing 240 postprandial and the fasting above 130. So here we have given the Grahani Chikitsa, Mustakarishta, we did it. And for external application, we give Prasarani Taila. And I think he underwent a course of Nasya also, Griva Basti and Nasya. And for a few days, we gave Brahatvat Chintamani. Then blood sugar is stabilized. And I told him to stop that diapride. With that stopping diapride also, the blood sugar remained in the lower level only. Another patient came to the history of hepatitis, fresh hepatitis B case with the increased liver enzymes. Here also he had a lost about more than 8 to 10 kgs of weight. Atimutrata was there, Prishtakati, Shula was there, Daha, visual disturbances, Gratita Malapravati, Medra Agrabhage Tvacha, this Putana and Daha. Here we did the Kamalahara Chikisa. We gave Patolakatronyadi Kashaya, Madhumeharakwata with Madhumeharakwata and Chandra Prabhavati. He also underwent a course of Virechana and Dhara. Initially, we did the Dhara with Amalaki Kashaya. So then immediately we can see the level started reducing and also all the symptoms got reversed and we have stopped the medications. Another case is a case of Udara Advana, Udgara Bahulya, symptoms of the Gulma Lakshanas, Malabadhatas were there. But he has observed the increased blood sugar levels, but Madhumeha Lakshanas were not observed here. Here we treated for the Gulma only, Indukanta Kashaya was given, Kamudga with Mukta Yukta was given, Gandharva Sthari Taila. For a few days we gave, all Gulma Lakshanas disappeared. But sugar levels remained same, but he never had any obvious symptoms. So whenever symptoms of Gulma, we told in terms of diet what to take, what not to take. He is managing with diet alone. We observed since 2009 till date, no medications were given right now. So he is absolutely fine. Another patient aged about 21 years, fresh case, Krishata of Sharir, lost about 12 kgs of weight. Daurbalyata, increased Shuddha, Chumuchumayana of Urdhvashaka, Atimutrata, Madhurasyataha, Madhuragandatva. This is two symptoms what I can see. This is Pururupa, mentioned as a Pururupa in Prameha, Madhurasyata and Madhuragandatva. Here we can see that Lakshanas. Here we have given majorly diet, Patya, what to take, what not to take. Because young adult and we did a course of Takradara and Virechana. With that itself, the blood sugar from 350 dropped to 84 within a span of few months. The fasting sugar from 250 dropped to 97. So within a span of a couple of months, he got better. And we encouraged him to do exercise, specific diet. He continuing that. So that helped him a lot to overcome. Otherwise, doctor has suggested C-peptide level were low, fasting insulin was low. Doctor was suggesting he's a type 1 diabetes, go for a insulin. Insulin is the only choice they have mentioned. You have to take lifelong. But he could overcome. Now this is almost November 2023. Almost we have passed 6-7 months. No absolute, no symptoms of Madhumeha. Another patient complains of swasa since many years, associated with the staulya. This patient was diagnosed as a hypothyroidism since many years, and she is on Eltroxin, 100 mcg. And with that Eltroxin, her TSH level was more than 52. And I have seen most of the cases of upper respiratory allergy or respiratory allergy, they are more prone for thyroid, hypothyroidism. So there is no need of giving any thyroid medication as such. If you treat that swasa or upper respiratory allergy like Pena Sapatishaya, they will become all right. So here she was taking that, and one day she come up with a altered LFT, elevated ESR level, elevated blood sugar level. The fasting is more than 350. So we have encouraged her, told her, we gave the medication for thyroid as well as for the Madhumeha together for a couple of days. Actually, for this patient also, they have recommended to go for a insulin. You have to no other choice. First, you think about it, going for insulin. If not, we will think about, later we can think about the other oral hypoglycemic drugs. She stood with us. She listened to whatever we said. She took this medication. We gave Pittarechika Kavata and Nisha Katakadi Kavata. Pittarechika Kavata is a combination of Patoladi Kashaya. Nisha Katakadi Kashaya we gave it with Chaushot Prarpipali, and her blood sugar recently as she has come up, only it is below 100. Another case, known case of diabetes mellitus since 20 years and on triglyceride forte, that too 3 times a day. But fasting blood sugar still with that medication above 200. Also hypothyroidism and stulata. So once you start taking these kinds of medicine, triglyceride forte, it may reduce your blood sugar, but you are not going to lose weight. You are finding how much ever you do the diet, you are finding very difficult to lose the weights. So we did a course of Virechana and Takradana, and also Ruksha Sveda is a kind of Udvartana in opposite directions. And we slowly tapered the dose of triglyceride forte. We gave Shivagulika and Asanadi Kashaya. With this, it is almost coming to the normalcy. She lost intensive weight also. Another patient complains of supti in the Anguli Pradesha, Asyashosha, Alpatantra, Shramashwasa, also complains of weight gain and grade 2 fatty liver and cholelithiasis since 15 years. On random investigation, he found to have increased blood sugar level. His HbA1c was more than 10. So here what we have to see that fatty liver, I have brought some picture here. So healthy liver and fatty liver. People think that fatty liver is non-alcoholic fatty liver. I consider there is no question of alcoholic fatty liver and non-alcoholic fatty liver. It is all are alcoholic fatty liver only. Because once food we have consumed, apachamanam shuktatvam yatyannam visharupata. The ahara itself, it acts like a shukta. Shukta means it's a fermented. That fermented things is in the gut. When it's absorbed, liver has to play a role. There it converts into alcoholic fatty liver only. So hence, when you want to reverse, you have to tell them ajirana has to be conquered. Grahani, the ajirana, various type of ajirana has to be conquered first. So we gave him Varanadi Kashaya, Vasaguduchari Kashaya, and Mamejava Ganavati. With that, and some diet we recommended, slowly dropping the blood sugar, and he became almost normal. Recently, we did the fatty liver check also. After 3 months, it came to grade 1 now. Probably another 3 months, I asked him to undergo a course of Virechana. If he does it, probably it will be completely reversed. Another patient, aged about 30-year-old male, lean build, having irregular food habits, complaining of Daurballata. So he is diagnosed as a type 1 diabetes. He was put on insulin, 18 units and 15 units. But despite his blood sugar levels were more than 400. Here, his diet pattern, he is a priest by profession. Timings of food is irregular. He takes food outside. Timings he can't predict. So all those things we have convinced him have to do like this. So what time what diet you have to take. Especially this year, we have recommended the mantha kind of diet twice and one meal a day. With that, slowly we tapered his insulin level. Blood sugar also started coming down. So we put him on the Chandra Prabhavati, Mamejavaganavati, later Madhumeha Rakwata. So slowly it reduced. Now he is on Madhumeha Rakwata twice a day and Chandra Prabhavati. That is the only. We have stopped completely insulin. So he never underwent any cleansing procedure also. Probably if we done the course of Dhara and Virechana, probably we'll stop on other existing medicine also. So like this, we have lots of cases presented. With the time limitation, I presented few. Couple of things I would like to say. One case, he had a brothers, two brothers were there. Both are obese, more than 120 kgs. One went ahead with the Ayurvedic therapies, another went with the modern therapy. Both were doing good amount of exercise, but the first one, he lost weight, he controlled this as 120 to he came to 80, 85. He had still high sugar level, but no complications observed. Another, his brother, he went no control over the diet, exercise, he was doing it, but started taking modern medications, went ahead. Later, he had a coronary artery block, hypertension. He was taking medicine for the block also, coronary artery block, blood thinner, anti-cholesterol medications, hypertensive medications, and anti-diabetic medications. And weight is still 120. This person is not much on medications, very limited medication. So this is what we are seeing. So ensure the patients, if they are overweight, reverse their weight. That is the priority rather than looking at the blood sugar level. So the classical preparations, what we give usually the asanadi kashaya, we usually give it person with the kapha dominance, Deshakada, Katakadi, Aragvadadi, Kadirakramukadi kashayas, Chandra Prabhavati, Mamejava Ganavati, Jambasava, Chandanasava. When Pitta dominance is there, go for the Asava preparation, Aragvadarishta, kapha dominance condition. Some whenever the intensive Dhaurbalyata observed, we give Vasanta Kusmakar Rasa, Shivagulika in case of Kapha Pradhana, Makaradvaja also, and Jambu, Trifala, Haridra Churnas, Amalaki Churnas, this as a Churna, sometimes in combination with the Yashada Basma or Trivanga Basma. When the goes beyond for the purpose of Snehapana or something, or a Shamana Sneha, we give this kind of Gritas, Kukul Tiktaka, Mahatiktaka, Padmakadi Grita, Shatavari Grita. And sometimes later, in case of need, we give Avrita Avartita Snehas and Lehas, Rasayanas also, because later we have to give Rasayana as the major source to preventions. Some of therapies we give Dakradara with the Mustamalaki Kashaya, or Asanadi Kashaya, or Aragvadadi Kashaya, Vamana Virechana procedures, Vrukshasveta, Udvartana. We recommend them to go ahead with the Vyayama. When people are not able to do Vyayama, the physical, something like a Udveshtana kind of things, better some other person can do it. For example, old age, too much fatigue or obese, they may not be able to do it. Or at that time, they may be having difficulty in walking also. At that time, better someone else do the Vyayamas. So our observation should be always Dhatu Samya. Tasya Lakshanam, Durgopashamanam, Swaravarna Yoga, Sharira Upajaya, Balavriddhi, Abhyavrta Aharasya Abhilashaha, Ruchir Ahara Kale, Abhyavrutasya Aharasya Samyak Jaranam, Nidralavam Yatakale, Vaikarikanam Swapnanam Adarshanam, Sukhena Chapati Bodhanam, Patamutra Purisharetasam Muktihi. Sarvakarye, Manobuddhi, Indriyanam, Avyapatti Riti. This observation, what we have to do, this is what I call it as a self-health assessment. This is what we have to do. With this, I'll conclude. Madhumeha and its complications can be effectively managed. Present-day comparison with the diabetes mellitus needs proper analysis. Bringing down blood sugar is not the priority in many cases. Awareness about the false claims. For example, we will bring down the sugar by giving Ayurvedic medicine also. Probably it is not a good idea. We have to go look into, educate them. The blood sugar is not an important issue here. Giving importance to the underlying diseases, emphasizing diet and lifestyle apart from the medication. Look for the Swasthya Lakshana. With these few, I conclude my session. Thank you. Thank you everyone for patience listening.
Thank you very much. It was really very nice.
Thank you, sir. Any doubts or queries?
नमस्कार सर, मैं डॉक्टर पांडे बोल रहा हूँ। ये आपने तक्रधारा का बताया है, तक्रधारा में कितने दिन करना चाहिए?
We will do it from 7 days to 14 days. 7 days to 14 days. Huh?
Okay.
So in case of need, you can repeat it. Sometimes it is good for the uveitis, retinitis, bleeding in the retina. This is an effective procedure. Bring down the intense daurbalata. Blood sugar will drop. If it is udvega janita, shoka janita, blood sugar will drop like anything because it's a vojovardhaka. Therapy itself is vojovardhaka. This is like something like a central stimulant. Regulate the vata at the prana level. Prana vata level regulates.
Thank you, sir.
Sir, you can stop the screen sharing.
Okay.
Okay.
Hello, sir.
Namaste.
Say namaste, sir. Sir, you said we need not worry. We can ignore the high level of blood sugar when there are no symptoms mentioned in Ayurveda.
Yeah.
But is it so if suppose these symptoms are there, but blood sugar is normal, so should we consider it as prameha or not?
Yeah. We have to consider. Yes, we have to consider. Yeah. So blood sugar, that's the difference between madhuryata of tanu is different, madhuryata of rakta is different. Madhuryata of rasa rakta is different. What we are seeing madhuryata of rasa rakta. We are not seeing the madhuryata of tanu. So if voja is going out in the urine, probably we have to consider. Bahumutrata is there. We have to consider.
Despite the blood sugar levels are normal.
Yeah. We have to consider. We have to treat like probably some other kind of prameha because prabhuta mutrata and avila mutrata is the core symptoms of prameha. We have to treat like prabhuta mutrata, avila mutrata. That we have to consider.
So there are many patients. Despite of the blood sugar levels are normal, the people have these symptoms. So we have
correct.
to
You're right. You're
we
right.
have to
You
treat
are
as
exactly.
a prameha.
Yeah. You are right. Exactly. So that means we have to develop some criteria. For example, the avila mutrata, further studies are required. So they have Voshta Shushkata, night urination is more, they keep going, Voshta Shushkata is there, Trishna is there. So Meha Lakshanas are there, but blood sugar may be normal, but their suffering is there. We have to address that. Still we can consider as a Prameha only. No need of ignoring that. Yeah.
Okay, thank you, sir.
Sir, there
मुरलीधर
are
जी
few
बहुत बहुत
questions.
थैंक्स का बहुत
Thank
बहुत
you.
धन्यवाद। बहुत आपने जो है प्रेरणादायक और बहुत ही गहराई से इस पर वर्णन किया मधुमेह पर। शायद हमारे बच्चों को पता नहीं होगा कि जो डायबिटीज थी वो हमारे भगवान गणेश जी को थी। जो गणेश जी को जो गणेश जी को स्तुति करते हैं तो उसमें कहते हैं गजाननम भूत गणादि सेवितम कपित्थ जम्बू फलचारु भक्षणम। तो कपित्थ जम्बू का जो प्रयोग किया गया है वो बहुत ही साइंटिफिक है। गणेश जी जो है लड्डू बहुत खाते थे, तो लड्डू खाने से उनको डायबिटीज थी, तो उनकी स्थिति में जो है कपित्थ जम्बू का प्रयोग किया गया है। इसी तरह जो हमारा जो जम्बू और पित्त का प्रयोग है वो पूरा साइंटिफिक और वैज्ञानिक है। इसलिए बहुत बहुत बधाई। मत समझाए थे मधुमेह, आपने बहुत सुंदर चित्रण किया भाई। मुरलीधर जी बहुत बहुत साधुवाद और बधाई आपको।
So we have one Jambwadi Churna in our clinical practice. We put Jambu Churna, Amalaki Churna, and Methi Churna, and the Haridra, and little bit of this Kalamega. Together we gave a combination. Works wonders in the Madhumeha patients.
Sir, there are few queries in the chat box. I will read them out.
Yeah.
One is, what type of medicine should be used for Virechana?
We can go ahead with the simple Virechana like Trivritleham. Trivritleham will be good. If they are Stula Pramehi, you can also go ahead with the Danti kind of Virechana. Ichabidi, we can give it. In case of Udavarta, Gulma kind of disease, we can go ahead with the Gandharvastadi Tela. Erandasneha Prayoga can be done.
Sir, what? Please tell about the daily regimen a Madhumeha patient should follow and what food to take.
I could not get it. Can you repeat?
Yes, sir. The daily regimen the Madhumeha patient should follow.
So whatever the Patya mentions in the classics, they have to follow that. I usually recommend 1 meal a day if they are obese. If they recommend one meal a day, that is the excellent choice. Huh? So at least we have a saying that 1 meal a day is yogi, 2 meal a day is bhogi, 3 meal a day is rogi, 4 meal a day you can carry away. That is the saying. 1 meal a day is excellent. Another two small meal they can find something like either porridge or some smoothie or some vegetable soup. They can plan, or the manta, these kinds of things they can plan it. 1 meal a day, it will be good for in the initial phases. It's an excellent. They can do it for about 1 month or 2 months. Then they, when stabilized, they can carry out. Here we have a people are using ragi ball. Ragi ball is the main diet. It's a kind of millet, ragi millet. They use it. So I say that if you are working in the field, you have to take ragi ball. If not, you have to take ragi manta rather than taking a ragi ball. Similar things, if you are taking roti, chapati, these are heavy food. If you are sick, better to go for a manta, peyaga, that kind of diet to come back, ensure that you have relieved of ama, you have relieved of bahudosha, then you can go ahead with the normal diet. Ensure that your ideal weight is achieved.
Yes, sir. The next question is, how Takradhara works in Madhumeha? What will be the mode of action?
So it is a majorly central acting. As I mentioned in the initial slide itself, the Tridosha Kopa Nimittaha, that is, Vata is also involved in the Madhumeha, especially Vyana and Apana. Vyana and Apana are controlled by once again Prana. Prana is located in a higher center. Prana has a control over all other Vatas. When you control the Prana, so most of the Udvega, Chinta, Bhaya, Shoka, all will reduce automatically. Central regulation, it is a central regulation, have a control over the other organs in producing the normalizing the dhatu samya functions. And also it is vojo vardaka. Vojo is going out in madhumeha, so it increases the vojas also.
Excuse me, can all others mute yourself? Sir, the next question is, if there is no symptoms but only high blood sugar level is there, how do we approach the case?
So if that condition, if it is there, so we have to ensure whether they are overweight or not. If they are overweight, ensure that weight is reduced, or if that stress is the cause, relieve of their stress, or any other hormone imbalance is causing that increased blood sugar level, that you have to tackle it. Other hormones you have to check into it.
Sir, the question is, we have to notice do we have to notice glucose spikes for diabetes?
Pardon?
Do we have to notice the glucose increase spike in diabetes?
Yeah, that we have to observe in case of need, because if they are already taking medicine, this observation has to be done. For example, when we do Snehapana, we keep checking that blood sugar level. Usually when we do some therapies, they are taking already medications. We have to withdraw the medication sometimes. When you are doing Snehapana, we have to withdraw the medication. What we are observation is, when we do Snehapana, so the blood sugar drops intensely. Whatever the aggressive blood sugar will drop. At this the ideal time to withdraw some of the medications. So later, probably after the Virechana also, that trend will continue. Vamana Virechana, the trend will continue. Sometimes if they go out of balance in diet or lifestyle, suddenly its spikes will be there.
Sir, regarding Snehapana, the query is whether prior to Virechana, all the Pramehi patients need to be given Snehapana.
Yeah, after ensuring the Amapachana, we can give it. Only thing is, in some of the cases like Prameha, our Snehapana should be Nati Snigdhan Vishodhe. Visha Abhigata Pidakaha, Kushta Meha Visarpinaha, Kamala Pandu Meharti, Nati Snigdhan Vishodhe. We should not give Snehapana to larger extent. We have to give it, but ensure that because the disease is at the level of Mamsa Meda, maybe we can give little Sneha because already Sneha is there inside the Sharira. So no need of giving much Sneha. But Ruksha Rechana should not be given because it is a causative factor for Gulma. So Sneha Sveda Anavabhyastaha Panchakarmam Prakurvita is the causative factor for Gulma. Hence we should not do it. Unless and until we observe Bahudosha Lakshana, dosha is moving out of the body, there we can give direct Virechana. Otherwise, better not to give direct Virechana.
And the question is, will you please explain what state of Vyadhi we have to take in case diabetic foot ulcer is there?
Diabetic with?
Diabetic foot ulcer.
What diet to be taken?
No, in diabetic foot ulcer, what is the state of Vyadhi? In terms of Ayurveda, will we understand?
Yeah, it is actually mentioned. It's a Prameha Pidakas are mentioned. Usually in Adoshaka, they are more prone for Pramehas, are more prone for Adoshaka Vikaras. Usually it is maybe once one disease sets in, other days will take over. For example, they also land up in Vatarakta kind of disease. So we have to tackle like a Prameha Pidaka, Vrinavat Chikisa has to be carried out. So usually it is mentioned the Vrinaha Krichena Siddhanti. Tushtinam, Vishajustanam, Shoshinam, Madhumehinam, Vrinaha Krichena Siddhanti. So we have to ensure that it's slowly, but we can do Shodhana there and we can go ahead with the treatment should be like Vrinavat only. And in the meantime, we have to tackle the Madhumeha also.
So, regarding Snehapana, how to decide which Sneha to be used for Snehapana?
So usually we see the Kapha Pradhana also having a Madhumeha. We have mentioned that Doshavrta Patajanya. Madhumeha is Doshavrta Patajanya. That means Pittavrta, Kaphavrta also possible. So when Pittavrta is there, go ahead with the Mahatiktaka, that kind of Sneha. We can go ahead with the Padmakadikana or in case of Kaphaja, go ahead with the Dhanvantara Grita or Gugul Tikta Grita, that kind of Grita. If it is Shuddha Vatajanya, go ahead with the Avartita Sneha, that kind of is a good one.
So, can you explain the difference between Madhurata in Rasarakta and Tanu Madhurata?
It's a good one. So, Madhuryata of Tanu, when it happens, then only they develop the all symptoms which is mentioned in the classics. For example, Madhuram Yachameheshu Prayu Madvihamevati. So, Madhuryasa Tanu, in case of at that condition only we can see Ojo Meha is happening. Otherwise, Ojo Meha is not happening. If, for example, only blood sugar is elevated, they don't even have polyuria or polyphagia or polydipsia. When they have Madhuryat of Tanu, they are all these symptoms. The Pratyatma Lakshana of Prabhuta Mutrata and Avila Mutrata is observed when Madhuryat of Tanu is seen. Here, Avilatva is Madhurata of Mutra.
If we do not consider the blood sugar level, then how do we understand the prognosis?
No, it's very simple. Dhatu Samya is there, no? We have a criteria of Dhatu Samya. Assess that Dhatu Samya. Whether Nidra Labha is coming or not, Kshuddha Pradurбhava is there or not, Balavriddhi is there or not. These are all the important criteria to assess Dhatu Samya. That you have to say. Whether Dhatu Paka is happening or Dhatu Samyata is happening. That you have to make a difference. Any Vyadhi Nivritti Lakshana is there. Prameha Nivritti Lakshanas are there. We have to go ahead and check that. This I don't consider the blood sugar elevation is a we should not check it. You should check it. We have to make evaluations. Whatever the study is happening, we have to take into account. But our diagnosis should be based on our pratyatma lakshana mentioned in that disease.
So there is a case which has been shared here, and they want your opinion on the same. A 50-year-old male chronic diabetic patient since 20 years with HbA1c level 10, in spite of following ahara, vihara, etc., is currently presenting generalized itching all over the body without any lesions, rashes, etc. So here, what would be the priority in the management?
Whether he is taking only Ayurvedic medicine or modern medicine.
Whoever has asked the question can please respond.
I'd like to point out here, whatever it may be, I'd like to say, some of the drugs like the glimepiride contains sulfonylureas. Sulfonylurea drugs usually causes itching in the skin. So darkening of the skin, severe itching, urticarial rashes will be there. So blood sugar also will be high. No pidakas are seen, only kandu or sometimes the intensive, the shita pittavat lakshanas will be there, or only rashes or itching will be there, or sometimes no rash also, only twakrukshata and intensive kandu will be there. So we have to ensure in such drugs to be removed from their medication list. We have to, maybe you have to go for other medications. So many times patients comes with a lot of medicines, 5 to 6 varieties of medication. Sometimes, for example, glucorid forte, triog forte, 3 combination of medicines. So where glimepiride is there, that is one of the major cause for the itching is to happen. Such drugs has to be withdrawn.
So, sir, in such conditions, the management priority we have to consider as prameha upadrava and treat, or first treat prameha and then the
both has to be tackled together. Both has to be tackled together.
Sir, usually during snehapana we give many restrictions to the patients, even in the annapana. But diabetic person will be under their regular modern medication. So how should we advise them to take this medicine during snehapana?
So if they want, because we need not stop their insulin or oral hypoglycemic drugs immediately. First you ensure before doing Shodhana, directly better not to go for Shodhana, because already Kledatva will be more. Kledatva in the body will be more. Shitilata, Abadha Mamsa, Meda will be more. Better not to go for Snehana or Shodhana immediately. Ensure they have some Stiratva in the body. During Snehapana, especially if you are doing Snehapana, on that day morning dose can be avoided. Afternoon dose, night dose can be taken, no issue. But maybe you can keep monitoring the blood sugar level, and in case of need, you can reduce the dose of the medications. Afternoon, night dose also can be reduced.
Any other queries, or we wind up the session? So thank you so much, sir, for a very informative. I'm sorry, there is a question. The correlation between Manasa Roga and Prameha.
So some of the karanas or manasika medicines also sometimes a cause for the madhumeha. So one is chinta, udvega, bhaya, these are all the causative factor itself. Sometimes those who are taking the psychotic drugs may also lead to prameha, madhumeha, as well as obesity also. You are not audible.
I'm sorry, sir. Yeah, thank you so much, sir, for a very informative session and sharing your practical experience with us and all the students. So on behalf of the organizing committee, I would like to thank Dr. Muralidhar Bhatt, sir, for sharing his views on this topic. And I would like to extend my sincere gratitude to all our mentors, Devendra Tribhunaji, Dr. Vandana Siroha ma'am, Rajesh Kotecha sir, for their continuous support and guidance. to continue this webinar series. I would like to express my heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active participation, made this webinar a successful one. Last but not the least, I thank each member of the RAV organizing team who worked behind the stage to make this event successful. Our next session will be on the 22nd of August 2024 by Dr. Raju sir, who will be throwing light on Shara Karma in anorectal diseases. So hope to see you on 22nd. Thank you all. Namaste.
Thank you, sir.
Thank you.
Thank you, sir.
एसी में जो तुम्हारा डीएनएस है ना, सबसे बड़ी दिक्कत उसी की होती है एसी में। नेजल बोन ही अफेक्टेड होती है एसी में।